Communicating About Relationships, presented by Jade Greenlee, Samantha Hewa, and Jenna Strong. Please follow along in your textbook, Looking In, Looking Out, on page 27. Almost every statement we relate to one another has a content dimension about the subject being discussed. This is called a content message. It's as easy as saying, "It's your turn to babysit," or "I'm going to go walk the dog." A more practical example related to the health sciences would be a lab technologist calling a doctor about a critical result on a patient. The subject is the patient and their health, and therefore the content message should communicate information regarding the status of their condition. A good content message in this situation would be, "Hello, it's Samantha Hewa calling from the lab. I have a critical blood glucose result on patient Diane Mellitus. Her ID number is 192837, and the glucose level is 30 millimoles per liter." This message portrays the information regarding the patient's current health status. Not everything we communicate to each other is just a content message. Everything we communicate makes a statement about how we feel about each other. This is called a relational message. These messages mostly deal with one or more social needs. Sometimes we can be unaware of the relational messages because they match our beliefs and values. In other cases, we can become offended or hurt over the relational message and not about the content. Your problem may not be about the content, but the way the message was delivered. Back to the example of babysitting. If a person told you politely that it was your turn to babysit, you probably wouldn't have a problem with the relational message. However, had the person told you in a sarcastic manner, you would have most likely become offended. Therefore, you can infer that relational messages are mostly expressed non-verbally. Even though nonverbal messages can be helpful, they are often ambiguous and may have the receiver jumping to conclusions. Metacommunication. Metacommunications are messages that refer to other messages. Essentially, communication about communication. In the textbook, they use the example of, "I wish we would stop arguing so much," or "I really appreciate how honest you've been with me." Metacommunication is a really important tool to solve conflicts with one another. Refer to the next slide. There are many departments in a hospital, and it's important they evaluate and discuss the quality of communication throughout the organization. As an example, it's important for the nursing staff to communicate with doctors with the most current information about patients. At a staff meeting, Dr. Hewa brings the attention to the frustration he's been feeling with regards to the nursing staff's communication.
I feel as though the information about my patients isn't reaching me fast enough, or as accurate as it can be. I think if the nursing staff took a little more care in the delivery and quality of their messages, it would benefit the overall care of our patients.
As mentioned previously, a relational message expresses the relationship between two people dealing with one or more social needs. The most common ones are affinity, respect, and control. The first type of relational message, affinity, deals with how much one person likes or appreciates another. But not all affinity messages are positive. For example, a smile tells someone how much you like them. However, so does a glare. The range of affinity messages that people can send tells us that not all interpersonal relationships are friendly. Now for an example in the health sciences. Affinity messages play a major role in the employee-boss relationships in the hospital departments. Good boss versus angry boss. A boss who constantly displays negative affinity messages may cause the staff to feel resentful. However, a boss who consistently displays positive affinity messages usually receives positive employee attitudes in return. The second type of relational message, respect, is a social need to be held in esteem by others. You are able to like someone without respecting them. For example, you like a very close friend, but do not respect the way they behave. But you are also able to respect someone without liking them. For example, you respect a classmate for their hard work throughout the year, but do not like their company. Within personal relationships, respect is the issue where most of the conflicts arise. The last type of relational message, control, is the degree to which a person in the relationship has power to influence the other. There are two types of control. The first is decision control, where one person has the power to determine what will happen in the relationship. This can include minor decisions like what are we doing tonight, or major decisions like should we buy a house or an apartment. The other type of control is conversational control. This is another way to see how one partner influences the other. For example, who talks the most, who interrupts whom, and who changes the topic most. But the person who talks the most doesn't always make the decisions. In any relationship, there always has to be the distribution of control. This can be complementary, where one person has more control, usually referred to as one up, than the other person, the one being controlled, usually referred to as one down. Another distribution of control is symmetrical, where the people in the relationship try to find the same amount of control, but this isn't always practical. This type of shared control is what people usually strive for in relationships. The last distribution of control is parallel, where the persons in the relationship alternate between the one up and one down position as mentioned previously.